Um, Hello, Dr. Khadilkar. My name is Vira Muradasilova, and today I will present an evaluation of the campus blood pressure screening program. Before I start, I would like to apologize in advance. Because of the influence of the German language, I sometimes may not express myself completely correctly or choose the most accurate words, but I will do my best. Thank you. Let's start with the introduction. I choose the campus blood pressure screening program. The health condition we are looking at the hypertension or high blood pressure. The target population is university students and staff who attend campus health affairs and wellness events. These screenings usually take place at both run by the University Health Center. During these events, many students receive elevated blood pressure readings for the first time. The important question is whether this reflects a real increase in disease or simply better detection through screening. Why is hypertension important for public health? Um, First, it is one of the leading risk factors for heart disease, stroke, and kidney disease. Second, it is often called the silent killer because in the early stages it has no symptoms. And third, we are seeing high blood pressure more and more often in young adults. Early detection is crucial. It allows us to start lifestyle changes or treatment before any organ damage occurs. Screening is a form of secondary prevention. We try to catch the disease in the detectable preclinical phase before symptoms appear. Um, how does the screening program work on our campus? It usually takes place at University Health Center, both during Wellness Day or orientation events. They use automated blood pressure monitors. The person sits quietly for 5 minutes and then the measurement is taken. A positive screen is generally defined as 130 over 80 or higher according to current ACC AHA guidelines. If the reading is elevated, the student is referred to the university health clinic for confirmatory measurements and a clinical evaluation. They also receive educational materials about lifestyle changes. It is very important to understand the difference between screening and diagnostic testing. A screening test is done on people who have no symptoms. It only identifies those who might have the condition. It doesn't confirm the diagnosis. A diagnostic test is used after positive screening results. It confirms or rules out the disease. In the case of blood pressure, this means repeated office measurements or ambulatory blood pressure monitoring. So, when a student gets an elevated reading at the screening booth, it does not mean they already have hypertension. It means they need further evaluation. Mm, okay, now let's look at the accuracy of the test. Mm, Sensitivity is the proportion of people who truly have the disease and test positive. High sensitivity means few false negatives. This is important for screening. Specificity is the proportion of people who don't have the disease and correctly test negative. High specificity means few false positives. Then positive predictive value or PPV answers the questions. If the test is a positive, what is the chance that the person really has the disease? Then negative predictive value or NPV answers. If the test is negative, what is the chance that the person is truly healthy? Remember, sensitivity and specificity are characteristics of the test itself, while PPV and NPV also depend on how common the disease is in the population. Um, okay, let's calculate the numbers from 2 by 2 table. We have 90 true positive, 80 false positives, 10 false negatives, and 820 true negatives. Sensitivity 90 divided by 100 will result 90%. Specificity is approximately 91%. Mm, Positive predictive value is only about 53%, meaning almost every second positive result is a false positive. Negative predictive value is very high. It is about 98 and yeah, it is about 98.8%. These tell us that a negative result is quite reliable, but a positive result must always be confirmed with further testing. As a local evidence, I would like to share an observation from a campus wellness day in spring um, 2026. Many students came to the blood pressure booth, and for a lot of them, it was the first time they had their blood pressure measured. Some were quite surprised by elevated readings. Staff handed out educational materials and referral cards. However, the healthy center staff noted that not all the students actually come back for the confirmatory appointment. So, while awareness and access at the screening point are good, follow up remains a weak point of the program. To summarize, the strengths of this program are good sensitivity and specificity in a very high negative predictive value, and the fact that it is accessible, low cost, and accessible to students. The main limitations are the moderate positive predictive value. It is about 53% and incomplete follow up. My recommendation is to strengthen the follow up systems. For example, book the confirmatory appointment right at the screening booth. Send automated reminders and give brief counseling on the spot. I think this would significantly improve the real public health impact of the program. Um, Thank you for your attention. Here are the references I used for this presentation.